A status report on one of humankind's most vexing illnesses, Alzheimer's disease. This morning on For the Record. Good morning, I'm Neil Heinen. It is a confounding disease in so many ways, and it's getting to the point where I suspect there are very few of us whose lives have not been touched in some way by Alzheimer's disease. And yet we cannot overlook the advances in prevention, treatment, and care that continue to be discovered. And we will take care of just that this morning as I welcome to For the Record Jean Bachuber, Director of Memory Care at Oak Park Place here in Madison, and Paul Rusk, the Executive Director of the Alzheimer's and Dementia Alliance of Wisconsin. And thank you both very much for joining me this morning. You know, normally I know where to start these conversations, and yet this is one of those issues that I thought I would ask you, Jean. I'll start with you. Where do we start? Where do we start with this conversation? When somebody says to you, what's going on in the world of Alzheimer's? What do you say?
Well, I think there's a lot of hope going on. There's so much research out there right now that it does give families hope. We have so much focus right now is on keeping the mind healthy, and what's healthy for the heart is healthy for the mind. And I think what's important to focus on is there's probably not going to be any single silver magic bullet that's going to cure this disease, but it's going to be a lifestyle change. I think people are going to be looking more at physical exercise. Again, what's good for the body is good for the mind. Mental exercises, keeping those brain cells from atrophying.
Sure. And
socialization. And definitely diet. Diet is really going to be playing a very important part in looking at preventing this disease.
I want to touch on all of those before this show is over. But I think it's significant that you would use the word hope so early in this discussion. Paul, let me just ask you: do you think that that's sort of widely shared and felt?
It should be. There are thousands of researchers, including many right here at UW-Madison, that are dedicating their professional careers to finding a cure or what actually prevents the disease. But it's also important to keep in mind that when Alzheimer's does strike, that does not mean that your life comes to an end. There's tremendous program and services right here in your viewing area where people can get the help that they need to enhance the quality of their life. And that's what we're all about. Yep. And that's a very, very important part of the whole hope question, is what you can do to help yourselves and help your loved ones.
Do we know, Jean, what Alzheimer's is and what causes it?
Not really. There's definitely a buildup of protein in the brain that they think causes the disease. And so that's what a lot of the research is focusing on. And
do we know that it's genetic? Do we know kind of how it's passed down?
If you have it in your family, your risk factor is greater. But that does not mean that you are automatically going to get the disease. There's some play of events that we don't fully understand that comes together. There's more and more emphasis on what Jean was saying previously about ways that you can head it off: lifestyle, diet, exercise. Exercise is becoming more and more prominent as a way of heading off the disease. So we tell people don't get too overwhelmed just because you have it in your family.
So does exercise then have a specific relationship to the proteins in the brain that you're
They're thinking
mentioning?
that the more you exercise, the greater the blood flow to the brain. Yeah. It flushes out those bad proteins that collect in the brain. And as Paul was saying, many risk factors. For example, if you smoke, it doubles your risk of Alzheimer's disease. But if you quit, the risk factor goes back down. People with diabetes have a 60% greater chance of having Alzheimer's disease. If you practice the Mediterranean type diet, you can reduce your risk of Alzheimer's disease by 38%. So there's lots of of things that we have control of, that we can help our mind.
What's good for the heart is good for the brain, and you want to watch those cholesterol numbers very, very carefully, and you want to maintain your activity, both socially and physically and mentally. That's very important as well.
The Mediterranean diet, for people who aren't familiar, is high in vegetables, olive oil,
lean poultry, no little or no beef, a lot of leafy green vegetables, beans,
fish.
A lot of fish. Correct.
It's a good diet.
Yeah.
It's tasty in addition to being good for you. Okay, how about diagnosis and people's knowledge about when to seek treatment and what's Alzheimer's and what's not?
Well, the key thing is when memory problems, behavior problems, thinking problems impact daily living, then it's time to go in and get a complete workup. And that is very important because many forms of dementia, might not be Alzheimer's, are actually reversible. And even if it does turn out to be a form of dementia, there are 4 medications now on the market that actually slow the progression. And our big challenge is to get people in right away. There's a lot of denial and embarrassment about this disease that's very, very unfortunate. It's a disease just like cancer or any other disease, and you should go in and get it checked out. And if your family physician doesn't seem to know a lot about what's going on, we're fortunate to have specialty memory clinics in the Madison area that can really can do a very good job on getting you the diagnosis that you need.
Is there a trick to knowing what to look for? I mean, people my age, I mean, we laugh all the time about our memories, and it's hard to bring a name up when we want to, and we can't remember that song. So
that's normal
forgetting
aging,
where you put your keys.
Yeah,
yes,
right. I mean, you know, the stereotype.
Right.
When does that cross over to being?
When it starts to interfere with your daily life, when you are forgetting all of the time, especially newly learned information, and you can't recall that. People forget all the time when they come into a room, you know, what was I looking for? But for example, when you're driving in your car and you're in your own neighborhood and you get lost in your own neighborhood, forgetting where you put your glasses is one thing, but perhaps putting your watch in a sugar bowl or the iron in the freezer, those kinds of things. We all might make a mistake on our checkbook, but when you forget how to use a telephone, when you forget how to follow a recipe, those sorts of things, when they really interfere with your daily living, that's when it's a problem.
And I imagine we very quickly here then get into some pretty tough and sensitive areas for families, for loved ones, for husband and wives, who need to be the ones to say, well, maybe we should go and get this checked out.
Yeah, and sometimes it's helpful if you go in as a couple and both get it checked out. And that's what we'd like to see eventually, is that everybody get baseline testing in their 50s. That isn't here yet, but eventually we hope to have that.
I want to, when we come back from the commercial, I want to talk a little bit about what information is available, particularly on the internet, where a lot of people might go. Some of it's good, some of it's probably not so good. We'll talk about that when we come back right after this. Our topic on For the Record this morning is Alzheimer's, and my guest, Jean Bachuber, Director of Memory Care at Oak Park Place here in Madison, and Paul Rusk, who's the Executive Director of the Alzheimer's and Dementia Alliance of Wisconsin. In the first segment, Paul, you said, talked about getting it checked out when memory starts to become an issue. And I just want to make sure we're clear. That's the point where you go to your physician, right? To your family physician to start with?
Yes.
Before seeking some specialized care?
Usually, and talk to the family physician, and unfortunately not all family physicians are very knowledgeable about Alzheimer's. So it's perfectly acceptable then to go to one of the specialty clinics. And you know, we have several right here in our viewing area, which are available.
Great.
So,
and we'll talk about this a little more later. But going through your website, your organization would be a good resource.
Absolutely.
For finding these places.
A lot of times there's denial with the loved one wanting to get it checked out, and we can help you with strategies to employ to get your loved one in.
Yeah. This is true about almost everything in the health world today. People are going to the internet and they're looking for resources. And I suspect this is true with all illnesses, but just the little bit of research I did on Alzheimer's, it was astonishing, the breadth of topics. And I mean, some things that just popped up, you know, from the very serious about unraveling the small molecules that could untangle the complex disease in Alzheimer's, looking at cleansing the brain of these plaques, you know, that they're talking about. But then there's talk about about coffee and the role that caffeine might play. On the same website, there was something about marijuana may prevent Alzheimer's disease. I mean, now that's the kind of stuff that's out there, and people are going to have to sift through that. How do you help them, Jean, figure out what's helpful, what's not?
I think families are definitely very overwhelmed by this devastating disease. They feel alone, they're confused. I think it's very important to go to your physician. Again, as Paul was saying earlier, there's so many things that mimic Alzheimer's disease, depression, thyroid problems. So it's very important to see your doctor, to have a memory workup. And what's so important is early diagnostic testing, because the earlier we can put a name to this disease, they can treat it. And there's so many drugs out there right now. Paul said there's 4 that if we can treat them early on, it will actually prevent the progression of the disease. We're never going to go backwards, but it can prevent the progression. So again, informing yourself on the internet is fine, but I really think it's important to go to your physician, go to the Oak Park website, go to the Alzheimer's and Dementia website, because you can get a lot of mixed communication messages from them.
Yeah, clearly.
Yeah. And Neil, I'm fortunate by a whole office full of dementia experts that are tremendously skilled, that are great just talking on the phone, meeting with families, and helping them sort through all of the options, because you can really get confused by just what you're reading on the website. And we can help with that and actually enhance the quality of life for your family and the person actually with the disease.
These are people who sift through this stuff.
Absolutely, every day. We do professional trainings out in the community. We're coming over to Jean's place soon and try and share that expertise with the community.
Now, these 4 drugs, they're pretty good?
They're a start.
Okay.
The next series of drugs that we have hope will come soon will actually halt the progression of the disease in its tracks. What we have now can slow, but we don't have anything to halt. And so we've got our fingers crossed that those will come out soon, and that will really change the disease tremendously if we can actually halt, and then it becomes critical to get somebody in the earliest stages.
Are you both comfortable with the pace of research? I'm sure it's competing with...
We need more. The baby boom generation, we're going to have a doubling by 2050 that will bankrupt Medicaid and Medicare. We've got to up the pace or we're going to have a national crisis.
Just to give you, put it in perspective, more people die each year from Alzheimer's disease than breast cancer and prostate cancer combined. While we're sitting here, this 30-minute program, 1 person every minute will be diagnosed with Alzheimer's disease. Yeah. It's a devastating disease.
Yeah, it's the 6th leading cause of death right now.
I don't know how many people think of it as a fatal disease. I think isn't it more often looked at as a chronic disease? What causes death with Alzheimer's?
It's really, every person is different. It's generally a 10 to 15-year journey people often refer to it as the long goodbye, and it truly is the long goodbye. And the easiest way I can explain it is going backwards. And in my center, by the time a person is at the end stage of the disease, they have the abilities of a one-day-old child. They're not able to hold their head up. They're not able to speak, walk. They don't recognize their loved ones. And by the very end of the disease, once they have food or beverage in their mouth, they don't even